Welcome to This Explainer. A lot of times when we hear words like traditional or natural medicine, we kind of just picture, I don't know, a loose collection of herbs or maybe some ancient folklore. But today, we're diving right in and moving way beyond those random natural remedies. We're going to uncover the highly structured, genuinely comprehensive medical architectures that are operating right beneath the surface. And to do that, we actually need to tackle a massive misconception right out of the gate. So, does natural always mean safe? Well, no, definitely not. Poison ivy is 100% natural, right? But you wouldn't want to rub it all over your arm. As you'll see today, properly evaluating patient safety requires a heck of a lot more rigor than just slapping a natural label on a treatment and calling it a day. So, to really get this, we have to start viewing these practices as whole medical systems. Basically, think of them like different operating systems for your computer. You've got Mac, you've got Windows, and each one has its own internal logic, its own worldview, and its own specific way of diagnosing the body. You can't just drag and drop an app, or in this case, a therapy, into a totally different system and expect it to work flawlessly without understanding the underlying code. Okay, so here's our roadmap for today's explainer. First, we'll unpack whole medical systems. Then we'll explore traditional Chinese medicine, move on to Ayurveda and inner balance, look at indigenous healing practices, and finally, we'll figure out how to safely compare and integrate all of them. Let's kick things off with Section 1, Whole Medical Systems Explained. We really need to transition away from throwing around broad umbrella terms like alternative medicine. It's just too vague. Instead, we have to recognize that each specific named system has its own totally unique logic and safety boundaries. By zooming in on these codified systems, we can actually evaluate the evidence and the regulations for each unique practice. Moving right along to Section 2, Traditional Chinese Medicine. So traditional Chinese medicine, or TCM, is this incredibly structured system that is entirely focused on harmony. It's all about the flow of qi, that vital energy, and balancing yin and yang across specific pathways called meridians. Now, you won't find these meridians in a standard Western biology textbook. Instead, think of yin and yang as complementary forces, like rest and activity or cold and heat. That balance literally forms the internal guiding logic for the whole shebang. And when you compare that to what we're used to, notice the profound contrast in how we view the body. A standard biomedical diagnosis basically uses a magnifying glass to find a specific broken part, right? Like tissue damage or a skewed lab result. But TCM? TCM pans all the way out to look at the entire ecosystem of the patient. It uses something called pattern differentiation. This means grouping all of a patient's unique signs together to identify a much broader imbalance, which then directly dictates the treatment. And this holistic worldview naturally leads to a highly logical diagnostic flow. A practitioner doesn't just say, match a single symptom to a single herb. Actually, they gather signs by observing things like the patient's pulse and tongue, synthesize all those little clues into a pattern of imbalance, and only then do they select a customized treatment. It's like putting together a giant puzzle. To restore that delicate balance, TCM uses a pretty diverse toolkit. Depending on someone's specific pattern, they might receive acupuncture to stimulate those meridian points, maybe alongside some customized herbal medicine, or even movement practices like Tai Chi or Qigong. It is super common for these different modalities to work together to treat just one single underlying root cause. But okay, here is our golden safety rule, and it's absolutely crucial. Just because a formula has been used for centuries doesn't mean it's automatically harmless. We literally must always evaluate the risks. Could an ancient herb interact with a modern pharmaceutical? For sure. Is the practitioner properly registered? Are they using sterile, single-use needles? Things like basic safety screening, like checking for bleeding disorders before you do acupuncture, that is absolutely non-negotiable. All right, let's shift gears to Section 3, Ayurveda and inner balance. In Ayurveda, human physiology is actually categorized into 3 primary energies, which they call doshas. That's vata, pitta, and kapha. Disease happens when these fall out of sync. This entire system is laser-focused on your own unique baseline constitution. So in Ayurveda, health isn't just something you have. It's an active, everyday process of keeping these doshas in total equilibrium with the environment around you. A huge central concept here is Agni, which translates to metabolic fire. Think of Agni as the engine of your body. If your engine is weak, well, you can't properly process food and nutrients, which obviously leads to imbalance. Because of this,
tailored daily routines involving highly specific diets and sleep schedules. This is known as dinacharya. These are actually your primary medical tools for maintaining health. Now, while things like yoga, diet, and herbal formulations might sound purely gentle and holistic, rigorous safety screening is just as vital here as it is anywhere else. For instance, has that imported herbal formulation been tested for heavy metal purity? Could it cross-react with a patient's liver or kidney medication? Even intensive traditional cleansing protocols like panchakarma have to be approached with modern caution, just to ensure we're never delaying a critical biomedical diagnosis. Next up is Section 4, Indigenous Healing Practices. Healing in this context is just completely intertwined with the land, with the seasons, and with shared community rituals. And it varies enormously between different tribes and cultures. This isn't some one-size-fits-all product you can just bottle up and sell. Whether we're talking about Native American medicine or, say, local Orang Asli practices, true healing here is deeply tied to family roles, ancestral connections, and the very specific ecosystem where that community lives. So, when we're interacting with patients who use these practices, something called cultural humility has to be our guiding principle. As modern learners, our goal is not to convince someone to abandon their spiritual beliefs, and it's certainly not to appropriate their sacred rituals for ourselves. Instead, it's about making a lifelong commitment to listening, understanding the cultural context, and ensuring patient safety with profound respect and absolute zero judgment. And that brings us to our final section, comparing systems in safety. This matrix right here is exactly why we can't just flatten all traditional medicines into one big generic category. A really weak analysis just looks at them and says, oh, well, they're all natural. But by comparing them directly, we can see exactly how TCM's focus on qi and needle hygiene requires a completely different safety protocol than Ayurveda's focus on doshas and product purity or indigenous healing scope limitations. Basically, specificity is the absolute key to safety. Let's make this real for a second. Imagine a 48-year-old female patient in your clinic. She wants to try acupuncture for her knee pain, but she's already taking prescription anti-inflammatories. How do you handle this? Do you just dismiss it outright? Or do you give a blanket yes without checking anything? We really need a structured way to navigate this exact kind of real-world integration. Well, you can use a super simple two-step approach here. First, validate her choice respectfully. You could say, it totally makes sense. You're looking for some extra pain relief. And then second, you establish the safety boundaries for co-care. You might tell her, acupuncture is great alongside your current medication as long as we confirm the practitioner is registered, they use single-use sterile needles, and we screen to make sure there are no skin infections near your knee joint. Boom! It's balanced, it's open, and it's highly specific. Which really leaves us with a final challenge to think about. We've seen today that traditional systems are vast, complex architectures of healing that demand both rigorous safety checks and a genuinely open mind. Integrating them isn't about blind faith. It's about active, culturally humble communication. So, as modern healthcare continues to evolve, how will you ensure active communication? Are you ready to ask the difficult questions to keep your patients safe? Or will you just settle for the natural label? Think about it. Thanks so much for joining me on this explainer. I'll see you next time.